Hello, my name is Marian. I'm 83 years old. I mention my age because I feel that it is very significant to the testimony I want to share with you today. Up until the 12th of May this year, 2009, I was a victim of scoliosis. I first learned that I had scoliosis in 2001 when on a routine visit to my medical doctor, I mentioned to him that I had quite a bit of back pain. He ordered x-rays and they showed that there was a slight curve in my back, though it wasn't serious at that time. He referred me to physical therapy. The treatments that they gave me and the exercises that they recommended that I do did help me and did relieve my pain. About my 5th or 6th visit, I came in with a very sore back because I had been helping my husband split and pile wood. When the therapist asked me how my back was feeling, I told him it was sore. He said they couldn't do any more treatments for me because Medicare wouldn't pay for them unless I made steady progress toward getting well. I was very surprised and terribly disappointed because I really needed that therapy. I left with the thought that there was no help available for my condition and I would have to make the best of it. There wasn't even a suggestion that I have an exam periodically to see if my condition was deteriorating. I had chiropractic treatments from time to time and they usually helped to ease my pain. In 2007, my pain really made itself felt, and I had to start using a walker every time I wanted to go someplace. A year ago, in 2008, my back had become much weaker, and I was unable to stand up straight. I couldn't be on my feet long enough to prepare a meal, or even long enough to brush my teeth, and the pain really wore me out. I had to lay down in order to get any relief. During my yearly visit with my medical doctor at the end of July 2008, I again mentioned my pain. X-rays revealed a very significant deterioration in my spinal condition. I was referred to an orthopedic clinic where I was told they don't do surgery on people my age because they're usually much worse afterwards than they were before. I registered with the Mayo Clinic in Rochester and waited almost 2 months to learn that they were too busy to see me. I had an MRI, an appointment for a cortisone shot, which my daughter advised me to cancel, then waited 6 weeks to see a spinal surgeon for a second opinion. He ordered a myelogram, which is a study of the spinal cord with dye inserted. He told me my scoliosis was very severe and that my spine was twisted like a pretzel. He would have me fitted for a brace. I got that brace on December 17, 2008. I was told I would feel very much better. What a colossal disappointment that was. It increased my pain and added more misery besides. When I sat down, the brace would dig into my upper thighs, and I had bruises with my many shades of blue, purple, green, and yellow. It looked like little bunches of wilted pansies. It dug into my armpits, partially cutting off circulation. The wing-shaped brace over my shoulder blades would always catch the shirt or sweater I had to put on over my head, and I had to struggle to get it down. I couldn't bend, so if I needed to pick something up from the floor or the ground, I had to go down on one knee, and then I couldn't get back up without help or something to brace myself on. I developed a burning, itchy rash on my stomach. I always had to have my feet completely dressed before I put my brace on, and if my shoelace came untied while I was away from home, it had to stay that way unless some kind person offered to tie it for me. I had to remove my brace when using the bathroom because I didn't want to buy underwear baggy enough to fit over it. It was hard to travel anywhere because the restrictions of a seatbelt kept me from changing my position when the pain got really bad. During the 5 months following the fitting of my brace, my condition grew worse because the brace allowed my muscles to just go on vacation. I had a hard time taking care of my home and myself, and I wondered how much longer I'd be able to stay there. I could not travel to see my children, 3 of whom live in other states. And I knew I could not continue to enjoy the recreational travel that I love so much. I felt my life was pretty much over, except to look forward to assisted living or the nursing home. I felt I faced depression and hopelessness every day. During the last week of April this year, 2009, my daughter, who lives in Green Bay, Wisconsin, was reading her city's newspaper when she saw a write-up about a chiropractor who specializes in the correction of scoliosis. She went to her computer to search for more information and found the doctor in St. Cloud, who, after many years of hard work, research, and determination, developed this specialized program. She called him and made an appointment for me because she knew she'd never get me to do it on my own. My first appointment was May 12th, and my recovery began then and there. This good doctor said the sweetest words I'd heard in a long time: "Take off that brace, you won't be needing it anymore." My treatments have been nearly painless. My progress has been outstanding for someone my age. My recovery from this debilitating disease did not require medications, risky drugs, or risky surgery, no bracing, no possible complications, or weeks or months of post-surgical recovery. I feel wonderful, and my children are just as excited as I am to get back to planning some travel and doing some fun things together again. I have exercises which I must do every day at home, and I will have an appointment for a chiropractic treatment once a month to maintain the health of my spine. I feel so blessed and so privileged to be able to share this story with you. I want everyone to know that this help is available. If I succeed in saving one person, especially a child, from the tragedy of spinal surgery or bracing or a life of pain, it will be worth any effort that I can make. I thank you, Dr. Wogan, for your years of hard work and determination and your dedication to your profession and your patients. And thank you for giving me back my life.